Good afternoon, everyone from Washington, D.C. I'm Daniela Tavo, a senior fellow with Atlantic Council's GeoTech Center. In case there's any confusion, I'm not Dr. David Bray, who usually hosts the GeoTech Hour. Today, we'll be talking about data-informed nutrition policy and practices. I am delighted, excited, and humbled to welcome our esteemed panel to the GeoTech Center. Dr. Dariusz Mosafarian, Julie Meyer, Dr. Joshua Smith, Tamra Ray Stevenson, and Dr. Taylor Wallace. According to the American Academy of Pediatrics, children who live in households that are food insecure, even at the lowest levels, are likely to become sick more often, recover from illness more slowly, and be hospitalized more frequently. Of course, lack of proper nutrition can lead to lifetime of health issues for adults. 1 in 9 people in this country are facing food insecurity, and many more are not receiving the nutrition they need. So my first question to all panelists is a very basic one. What are we getting right in the nutrition space, and what are we getting wrong? I'm first going to turn to Josh, then Taylor, then Tamra, then Dariusz. Could you tell us first a little bit about yourself, and then respond to the question what we're getting right and what we're getting wrong? Josh?
Good afternoon, everyone, as well. I'm Josh Smith. I'm the executive director at Vigor and hold an observer role on the investment committee at Mandatory Partners, a private equity firm based in Vail, Colorado. Our mission at Vigor is to quantify the relationship between nutrition and metabolic health because we see it as the most cost-effective way to reduce the growing burden of medical costs on both societies and individuals. We feel that by clearly quantifying this challenge, we are able to align the key stakeholders such as policymakers, corporations, financial markets, impact philanthropists, in order to fund the conversion of today's calories into healthy calories. To Daniela's question, I think the fact that we're having this conversation is indicative that we're getting something right today. I think there are multiple factors, but one that stands out to me is really this growing public awareness on the relationship between nutrition and health. It began showing up even before COVID. In 2019, Deloitte reported that more than 3/4 of consumers were actively seeking what they perceived as healthier options. That kind of transitions us to the risks and perhaps what we're getting wrong. In that sense, the risk for misinformation and greenwashing via implied health benefits is, of course, large, but really the biggest challenge I think we see today that at Vigor we're trying to address is this glaring gap that not even everyone who would want to have access to this food that we know is healthy has it. They're not even empowered to make these decisions to improve their health. So that's where we see a big piece of work.
Thanks so much, Josh. By the way, where are you calling from right now?
I'm calling from Vail, Colorado.
Lucky you.
We are appreciative of the storm we got, unlike I believe the rest of the country.
Where snow belongs, right?
Exactly. We'll take it.
So Taylor, next to you, can you tell us a little bit about yourself and answer the question, what we're getting right and what we're getting wrong?
Yeah, well, thanks for having me today. I'm Taylor Wallace, and I'm a research scientist at heart, and I guess by luck, a food and nutrition science communicator. I own my own research focused company called Think Healthy Group and am affiliated with and faculty at George Mason University. Think Healthy Group designs and executes research strategies that better inform food policies and public health messaging. We do everything from epidemiologics to large randomized controlled trials. In fact, just this last week, recruitment for our largest intervention study ever called the SAC-MOLO project, which is a large randomized controlled comparative effectiveness trial that evaluates impacts of child development, growth, and diet quality measures in 1,200 indigenous infants in Guatemala. So we're really excited about that. I also, by a little bit of luck, a few years ago, started blogging and ended up getting discovered by the Dr. Oz show. And 5 years later, I've been cast and have over 130 appearances on the show to date. And without saying too much, I feel like as a scientist, it was a really broad comfort zone. And I've been able to make a real dent in a lot of misinformation that's out there in the media, whilst down upon passion that I've never had. I think, you know, what we're getting right is the conversation. I think what we're getting wrong is, and I'll talk a little bit about it, is research and not investing enough in research. And I think we're not investing enough in policies that meet people where they're at in life. And I think we have to do a better job at that.
Well, I am also glad that we're having this conversation as you and Josh are. And by the way, you are my favorite guest on the Dr. Oz show, as well as favorite guest of many others. So I would next like to turn to Tamra and ask you the same question. Tell us a little bit about yourself, and then if you could respond to the question, what we're getting right and what we're getting wrong.
Well, thank you again for having this important conversation. The issue of nutrition for me comes very personal. As someone who's a fourth generation Oklahoma native, I come through my lived experiences from seeing family members who have died from diet-related diseases, my grandmother from diabetes, my grandfather from heart disease and stroke, and now living in a community in Washington, D.C., where we are impacted by food apartheid, where we have a grocery gap of 22 new stores that have come on board west of the Anacostia River, where mine has only one, serving more than 170,000 people if you include the two other stores in Ward 7, and a 20-year life difference between the communities living under the nation's capital. So for me, as someone who's been appointed to the DC Food Policy Council by Mayor Bowser, chairing food systems and nutrition education, this issue is one that is not only a philanthropic issue, but a business issue. I have now gone on to found WANDA, which is Women Advancing Nutrition, Dietetics, and Agriculture, which is on a mission to build a pipeline, a platform, and partnerships to support women and girls to become the food heroes that our communities so desperately need, and to build back better a food and health system that's integrated, and now understanding communication is a critical social driver that is not a part of the Global Nutrition Report that has come out to address the issue of nutrition equity, which I look forward to diving into. And so now, as a communication doctoral student at American University, I'm looking at the infrastructure issues and understanding this interconnectedness around power dynamics in media and technology, and how we look through the issue of democracy through the lens of food.
Tamra, I love the work that you're doing, and I love the work that all of you are doing, and your passion behind it. But 20-year difference in life expectancy is significant, and something that can't be ignored. Julie, I would like to next turn to you. Tell us a little bit about yourself and your background, and also responding to the question, what are we doing right and what are we doing wrong?
Yeah, absolutely. Great. Well, I'm so happy to be here. Thanks so much, Daniela, for inviting me, and great to see everybody on the panel. So I'm Julie Meyer. I am the founder and the co-CEO of Eat Well Global. We are a communications consultancy working at the intersection of the food industry, sustainable nutrition, and global health. Our team is about 18, including the US and Europe. So we have a very global perspective. And our mission is empowering global change agents in food and nutrition. And for us, we have always seen the food industry as really being one of the main drivers of that global health. And we see the folks working within the food industry that have the passion for nutrition, sustainability, and equity to be those change agents. So our job is to work with them and help them be as empowered as they can to make change within their organization. That's really the crux of what we do. We do work in 3 areas: insights, strategy, and stakeholder activation. I'm a dietitian. The majority of our team is dietitians. So oftentimes we really focus on that credentialed healthcare professional to be the voice of credibility and science that can bring the messages out. So based on what we think we're doing right, it's super exciting to see the food industry coming to organizations like us. We're B Corp, we're certified woman-owned business. We're very mission driven, and they want our input in helping them decide how they're going to move forward. Again, at that intersection with nutrition, often sustainability and equity, and what kind of changes they need to make, which is driven by consumers. So the fact that consumers are asking for these products, it certainly makes it a lot easier for food industry to decide they're going to make these products. But at the same time, I think there is a ton of misinformation, which I think we've heard now from everybody who's spoken, from Josh to Taylor to Tamra. I'm sure Dr. Mostafarian can agree with this as well, that there is a lot of misinformation out there from consumers. And I think that the ability to really hone in on that voice of the credentialed health professional who has that science background, who has that training, and who is able to really provide the science is the critical point. So I think we're getting right that consumers are interested. I think that companies are thinking about it. I think that they're being judged on it. It's a measurement that they have to fulfill. But what we're getting wrong is that there's still a consumer confusion and not always credentialed voices going back to it. And I am calling from Brooklyn, New York.
Welcome from Brooklyn. And first of all,
Thank you.
Back because you actually spoke on misinformation, disinformation, and food at our AgriTech Action event in November. And you were very popular. Thank you very much. And it garnered a lot of attention. Indeed, it's very challenging for consumers. Every day you read conflicting information about nutrition and about food. So thank you very much for broaching that. And I know that we'll talk a little more about that. Finally, I want to turn to Dr. Dariusz Mostafarian. Thank you very, very much for joining us. And I would like for you to tell us a little bit about yourself as well and respond to the question, what we're doing right and what we're doing wrong.
Yeah, thank you, Danielle. It's so nice to be here on this great panel. So I'm a cardiologist. I have a doctorate in public health as well, and my career has been devoted to understanding the science of nutrition and the policy around nutrition. So first, what do we actually need to eat to be healthy? And what policies and systems changes do we need to implement to get there? I'm the Dean of the Friedman School of Nutrition, Science and Policy at Tufts University. We're in downtown Boston. And we're really one of the leading institutions in the world to study both nutrition science and policy. And we're a very, I think, important and trusted, credible voice for business, for the public, for government leaders to try to shift the system forward. And I think we're at a potential tipping point in our country where there's an incredible attention around nutrition. So I think what we're doing right, as everyone has said, is the attention from the public, from business, from policymakers, the combination of COVID-19 and the fractured food system that we saw and the incredible racial inequities that we saw have really, I think, laid bare that we have a broken food system. I think what we're doing wrong is we still have fragmented voices and agendas. And so we have the hunger or food security stakeholders. We have public health and nutrition and avoiding chronic disease stakeholders. We have folks thinking about healthcare spending. We have folks thinking about sustainability and climate and topsoil and regenerative agriculture. We have folks thinking about national security and how obesity is, the leading issue, a medical issue that people can't enroll in the military. We have folks thinking about kids and healthy food in schools. And so if you put all of those things together, we actually have one of the leading issues in our country. And yet, if you look at the Biden administration's listed priorities, if you look at any of our political campaigns, food and nutrition is not one of the top 5 things that's discussed. And yet, if you again look at the Biden administration priorities, whether it's racial equity, healthcare, COVID-19, climate, or jobs and building back better, food and nutrition is foundational to all of those things. So I think what we're not doing well is connecting all of these seemingly disparate issues and letting people know, especially people in positions of power, whether it's business or policy, that we have to fix food and nutrition, and it's a win-win for everyone.
I have a quick rejoinder on that, Dariusz, because you mentioned a couple of very important things, including moving forward on the policy. And I have no doubt that you and other panelists here are going to be an important part of that. And I can also share with you, there are a number of folks from government, USDA, that are on the line with us today. You also mentioned that we're very fragmented. So I'm curious, from your perspective, the industries that you mentioned are large industries. Whose job is it to bring them together?
Well, yeah, I mean, for all of human history, feeding others has been one of the greatest wealth generators and job generators and economy generators. And put together, the food system is the largest employer in the world. And so if you put farms, retail, restaurants, food manufacturers, and now all of the additional healthcare, personalized nutrition, fitness companies that are also coming in here, this is the largest segment of our economy. In terms of preventable healthcare spending. This is the biggest single thing we can do. And there's a lot of interest in this, as you said, from business, from investors, from policy. And so I think what we need to do, we need to do several things. I think, and recently Tufts faculty wrote a letter to the Biden-Harris administration outlining a clear plan across 6 areas for implementing policy. But to help with coordination, first we need leadership. We need leadership in the White House, from the Domestic Policy Council, from the West Wing. We absolutely have to have the president involved. And I think 2 very concrete recommendations we have is, first, we should have a second White House conference on food, nutrition, and health. The last one was in 1969, and it led to most of the policies and programs at the federal level that we think of today when we think about food. It's been 52 years. It's time to have a second White House conference. And secondly, we need to have a new office, an office of the National Director of Food and Nutrition. Other people have called it like a food czar, to be sure that there's somebody, at the cabinet level who really understands and intersects all of these areas around food. And the analogy for that is the Office of the Director of National Intelligence, which was created after September 11th, when we recognized that we had all this investment in national security, but it wasn't integrated. There was no leadership and coordination. And the Office of the Director of National Intelligence has been very successful, very, very important for coordinating our intelligence. We spend way more at the federal level on food and nutrition than on national intelligence, and it's totally uncoordinated. And so I think those 2 things, the White House conference and a new cabinet level leadership position, would go a long way towards organizing our country's policies.
I couldn't agree more. I mean, I think that, if without proper nutrition and proper food, for our citizens, there's not much else we can do. It's difficult for children to learn if they don't have proper nutrition. For example, we have a morbid obesity issue in the United States as well. So I would like to turn back to Julie now and talk about the data that we need in order to make informed decisions. What kind of data do we need on nutrition and health, and how can we better ensure that the public makes smart nutrition choices? And especially given your background in communication on nutrition.
Yeah, absolutely. That's a great question. Well, and I love everything that I've heard so far. I think from our perspective, again, having that real food industry background and that sort of lens, as them being obviously a huge stakeholder in this entire conversation, is making it is both having the accessibility and ease of food companies to be able to communicate the nutrition around their products, so that and if you've worked with a large multinational company who has multiple countries and multiple offices, the ability for them to actually aggregate all of their nutrition information with reformulations or what have you can be really challenging. So I think the idea of creating a technology that makes it both easy for the food industry to be able to aggregate their information, and then easy for consumers to be able to access it, again, with that lens of filter of a credible health expert, helping them really translate that information. So I think having a way to aggregate the information, translate it, and be able to get it to the consumers, I think from a data standpoint, and I think that's the big change, right, in the last 20 years, that this accessibility of technology and accessibility of data. And again, you always need that lens, that filter. It's not just the quant, it's the qual, and how do you help people translate that?
No, I could not agree more. And I think that, we have the capabilities now, the technology to do this in a way that's never been done before. So I want to turn back to Tamra first, because, I remember when we first met, Tamra, and I was just so utterly impressed by you. You have an amazing background. And by the way, we both worked at FDA and EPA, which is something we have in common, a little bit unusual. But I want to talk to you a little bit more about this disparity. Can you tell us about the barriers and the opportunities and challenges to delivering nutrition to all segments of the population, especially in the populations that you've worked with, including women and children of African descent?
Thank you for that. And before I get to that, I just want to echo the point that Dr. Mustafarian raised around food and nutrition as a national security issue. I was a former born national security education scholar studying in Dominican Republic, and I realized that food security is a national security issue that we have to prioritize. When we look at the Black Panther Party, which Black women played a critical role in the free food program, they realized that in order to address poorly nourished, unhealthy communities as the ones that I reside in here in Washington, D.C., that we must recognize that once we're well fed, we're able to begin to realize and envision a society and the institutions where our populations are fully involved in the democratic process. And that is why the issue of nutrition is so important. Also, when I was a student in Tufts, I did not understand why we had a course called Health Policy, Politics, and Programs. But fast forward, working under the Bush administration in the Secretary's Office for Health and Human Services in 2005, when the dietary guidelines for Americans were crafted, I quickly realized that policy was not created in isolation, that we have ecological drivers that are impacting policies similar to the drivers of nutrition. And that's politics, that's propaganda that are influencing our public discourse that we're having even now, which is so important, and the sentiment among publics and about how we are also can be allergic to the data. And so that's why I've come to the realization that we must also address the communication infrastructure in our communities, in my community, in order for communities to better organize and inform and leverage their agency collectively to address these nutritional needs. And as countries and cities and communities are grappling with food security, and communication must be a part of that issue of policy, not simply designing a communication plan, but actually having communication as a policy, as a practice, as with an equity lens in addressing nutrition insecurity issues. And so when I look at the work that we do through WANDA, it has become crucial that those who have been shaped by these lived experiences must be a part of the co-creative process. And typically they are not. And so that is why we are centering women and girls and empowering them through media and entertainment education, and why we've launched the WANDA Academy to support a future of food heroes that our communities need, and why we are launching a Food Heroes Freedom Fund and celebrating our 5th anniversary this year to partner with organizations who wish to invest in women and girls to build a nutrition workforce that we need and that is not in existence at this moment.
First of all, congratulations on your 5th anniversary. You mentioned a number of important things, and it reminds me of a conversation actually that I had with Taylor, and I'm going to ask him the same question. But with regard to is the data that we're looking at, is it skewed in some way upon which our policy is based? And one last thing I want to say, Tamra, is it's amazing to me when we talk about the risk analysis process that one of the most important parts is risk communication that is often forgotten. And I think we need to recalibrate about how we communicate risk, including risk from not eating food. It seems like a lot of people are scared of certain foods right now that are foods that they should be eating. So turning to Taylor, the same question for you. And as well, if you can actually comment on Tamra's point about the data that we're using to make our policy decisions.
Yeah, so I'll take it from a little bit different of an angle as a researcher perspective. You know, recommendations and policies are only as strong as the data behind them and the models that are used to analyze that data. Right now in nutrition, we have very imperfect data, and the models that we use are based on mostly assumptions versus hypotheses and really hard, or assumptions and hypotheses versus what's really hard facts. And what this does is this hinders reproducibility. It puts a lot of miscommunication out there. One day, you know, an egg is good for you, the next day an egg is bad for you. And so it really means we need to invest in improving technologies for how we both capture and apply data. And I'll give you an example. I've been working a lot with alcohol policy lately. It's egregiously inaccurate how we capture and quantify alcohol intake. We have no clue whether one beer consumed is a 3% or 15% alcohol by volume beer. And I'm a scientist with a pretty keen knowledge of alcohol, and I have no clue how much bourbon is in my drink on a Saturday night. And I don't really feel like a long duration randomized control trial is likely to change that fact. Moving on, if you apply a J-shaped curve model to alcohol, it may show some benefits to risk of cardiovascular disease. On the other hand, if you apply a linear model, it may show detriment. We really don't know the correct model or how to accurately crunch the numbers. And I think this is significant. This example is significant because if you look right now all across the world, recent policies are being developed and changed and conflicted with one another. Different organizations are putting out different messages, but it's basically all based on the same data. It's just how you crunch it in the model. And, also look, my friend John and I had French fries and a mint flavored hookah last time I had a bourbon, 2 weeks ago. But last night I had a glass of dry red wine with my grilled chicken salad. So my point is that there's a lot we need to do and a lot we need to work out from a data standpoint before we can actually capture these relationships between diet and health. Now, having done this for, over a decade, research data is never going to be perfect. And that shouldn't impede us from making informed policy decisions. But, in my mind, it's kind of like you are what you eat. If you eat crap, you get diarrhea. And likewise, if crap data gives you shitty policy. I will say, and I appreciate the comments on the ecological drivers of how we set policy. I think that's a big issue we have in nutrition science. But I will say that this go around, the 2015 Dietary Guidelines Advisory Committee, I think really hit the head on the nail when they chose to look more towards dietary patterns. Because from a data standpoint, our data is very conflicted. And in nutrition research, we like to be very reductionist. So is calcium good for your bones? But what we really should be asking is, are diets higher in nutrient-dense foods like fruits, vegetables, whole grains, lean protein, things like that? Is that beneficial for bone health? The current data is just too confounded to be reductionist. And I'll finish my comment with saying, or repeating, I guess, that we need to invest more in USDA, in our national surveillance programs at CDC. And I'll throw a big one in there that I feel very passionate about. We have got to establish a national institute for nutrition within NIH, or we're going to look back in 20 years and see the same issues that have snowballed and continued to grow.
What I'm hearing are some themes emerge from all of you, which is we, first of all, need to focus on this and we need to get the right data, which means that we need to invest in research. And by the way, that's not just for food and agriculture. This is for any area that we're looking at that plays an important role in policy. Unlike the Dr. Oz show, we do not bleep you for scatological references, just to let you know, which is one of the nice things about working with Atlantic Council. But I want to turn to Dariusz because you gave us some really insightful remarks about what we need to do as far as policy gaps in nutrition, and others have echoed similar sentiments. So my question to you is one that came up with prior to this conference that we're having right now. I asked a number of folks that I know in the food and agricultural space what they wanted to hear about, and pretty much everyone said, we want to understand about incentivizing more production of healthy food and how nutrition impacts the economy writ large. What does the research show? So when I ask this question first of Dariusz, if you can take a minute to respond, and then to Josh, we'll turn to Josh, and then to Tamra.
Yeah, of course. And I really have appreciated all my co-panelists' comments. And I'll first just echo what Taylor said about the need for National Institute of Nutrition. The NIH is the world's leading research organization for incredible cutting-edge research. It's a wonderful organization, and yet it doesn't have sufficient coordination, organization, and funding for nutrition research, which is the #1 cause of poor health. And so, a National Institute of Nutrition, which would be additive, new budget added, not taking away from anything that's already going on in the other institutes, is essential. And over 80 organizations in our country, businesses, nonprofits, advocacy organizations have signed on to this call. And I put a link in the chat there for that. But I think one of the key things that has been missing from the conversation around food is the economic impact, the negative economic impact of unhealthy eating and nutrition insecurity, and the positive impact of healthy eating and nutrition security. We're talking about hundreds of billions of dollars a year. And so just as one example, on just diabetes, the US government spends about $160 billion a year on direct medical care just for diabetes. Over 50 years, federal expenses for healthcare have gone from 5% to almost 30% of the federal budget. And that's really just an unbelievable rise in 50 years. And that's crowding out almost every other priority. And so I think as long as we talk about just people suffering and dying, and we just talk about racial equity, and we just talk about the environment, we're only going to convince so many people that something needs to be done. But if we add national security and we add this economic catastrophe that's happening both to government and to businesses who are paying for healthcare premiums, and that we can fix all this, I think that that's really the solution. And so economics and true cost accounting for food has to be part of the solution. There are some very simple, immediate policies we can implement to try to address this. One is what we call food as medicine, integrating food and nutrition into healthcare. We spend almost $1 in $5 in the entire economy on healthcare, much more than we spend at the grocery store. And so we should be spending some of that money for healthcare on healthy food. And so things like medically tailored meals, produce prescription programs, healthy produce boxes, those have been tested and piloted in private and state programs around the country, and they work. And so it's time for Medicare and Medicaid to start implementing medically tailored meals and produce prescriptions. Second, in SNAP is an incredibly important and valuable program for targeting nutrition insecurity. SNAP only has about $50 million per year regularly for incentives for healthier eating. And $50 million a year sounds like a lot, but when you have today almost 50 million people on SNAP, it's $1 per person per year for fruits and vegetables. So that's really not sufficient, right? $1 per person per year. Think about what you would do with $1 in your wallet for a year to buy fruits and vegetables. So we need to substantially increase the healthy food incentives in SNAP. So I think those kinds of incentives are important. And then outside of the federal programs, Medicare, Medicaid, and SNAP, we really have to push and promote innovation, business innovation, private innovation. We have to reward companies, whether it's farms, restaurants, retail, healthcare, or food manufacturers who are trying to do the right thing and make foods that are more nutritious, more equitable, and more sustainable. And so we need a whole raft of policies to help reward businesses that are doing the right thing. It could be things like tax breaks, R&D breaks, new opportunity zones for investing. Many other things can be done. I think the U.S. should become the innovation hub for the world for a 21st century breadbasket for healthy food.
I love that, innovation capital of the world. And actually with that, I want to turn to Josh. Indeed, food security is a national security issue, which is why the Atlantic Council feels that it's so important to have this discussion. So Josh, with regard to the data, can you talk a little bit more about how we know from our data that nutrition impacts the economy writ large?
Yeah, certainly. And I think it's a very nice transition. Our organization is working, we're not the experts, we're working to align the experts such as Dr. Mozaffarian and Taylor in their research around this common challenge and then to scale that solution with the result of aligning those seemingly disparate stakeholders, as Dr. Mozaffarian mentioned. I think before I jump into that, the big analogy that resonates with me, we spent time trying to understand how to do this most effectively. Renewable energy development over the past 10, 20, 30 years underwent a remarkable transformation. Today, it is cheaper to install new solar and new wind than operate existing fossil fuel plants in many cases. That wasn't the case 10, 20, 30 years ago. Early technology development was being funded by research grants, policy, innovative companies or donors were out there. But what it appears happened was over time, science was able to quantify the benefit of these technologies to these different stakeholders: greenhouse gas emissions on climate change, the resulting migratory and war impacts, local emissions, often disparately impacting impoverished communities. And of course, the human health impacts of that, energy independence of the US, national security. So if you look at that analogy and try to understand how did that change happen, it comes back to me to the data and quantifying what is healthy. We're starting at the financial market since that's a place we understand. But if we're able to leverage the amazing work of leading researchers like these panelists to show quantitatively what is healthy, what companies are doing healthy things, what companies are making healthy products that are conducive to positive human health, what companies are enabling access to these products, we are able to direct this capital that is looking to make an impact most effectively. We're able to fund that early innovation to make this the innovation capital and it cascades from there. Companies are able to understand what they should develop. Investors are able to understand what they should look like. Bigger institutions, maybe we get to the scenario one day we have today with fossil fuels where you have large national pension funds that will not invest in a fossil fuel investment. So we really see the power of capital formation and leveraging the data, the true data, to demonstrate that and make everything comparable.
Thank you very much. And it's very heartening to see this group of nutrition scientists on this panel that are working so cohesively together. So we're about 38 minutes in. So I want to go to Tamra really quickly to respond to that question as well. And then I'm going to go to some audience questions.
Thank you. I want to first acknowledge that to the point about communication infrastructure, for me, that is what I'm currently researching on at AU. However, this issue is important to nutrition because one of my mentors, Dr. Shariki Kuminika, was a part of a research study that looked at how we frame nutrition in the media and over a 10-year time period that focused on the individual versus systemic issues that really have created the obesogenic environment in which I reside in. And that speaks to power inequities that must be addressed and ending the nutritional disparities from the access to the dietitian to the actual access to cultural foods and to the access to the grocery stores that many communities are grappling with. And that involves also looking at how we mandate and fund policy to support inclusive food entrepreneurship that is all about sustainability, supporting local food economy. That is a way of addressing food justice. And COVID has only exacerbated that issue, in that nutrition must be seen from an infrastructure issue. And so I wanted to hit on just a few points about if we are truly opening up to a new administration that needs to put nutrition center to this conversation from a security perspective, then we want to build nutrition back better by co-creating with our communities and organizations, particularly women of color who represent the base of the power structure in this country, who have these lived experiences that add value, that we must recognize that the 400th commemoration of the transatlantic slave trade, where my ancestors have been brought to this country to build the food system that has been broken and broken on their backs, must be a part of the solution process to this conversation. That if we're looking to build nutrition back better, we must invest in nutrition, not as a philanthropic issue, but again, it's part of the business issue where you will get a greater return on investment that has been echoed even by the World Bank in their Invest in Nutrition initiative. And if we want to build nutrition back better, we have to create more empowering images and narratives like my little Wanda character, who is the mascot for Wanda, and showing our children that Michelle Obama is doing with her new Netflix program, that they are the food heroes that we need in our communities. And we have to build back nutrition better by situating nutrition within the food system, from farm to health, that's sustainable and making a positive impact from people to planet and profit. And lastly, we can only build nutrition back better when we invest in our nutrition infrastructure at the federal and local level, from the research to the policy to the practice, by particularly investing in diverse diets that's not reflective in the DGA of this time, but we hope in the next 5 years, and also ensuring that HBCUs are part of the conversation that are producing the most nutritionists in this country to help address some of these issues. So lastly, with healthcare being such a large component of our GDP, Americans must be invested in through their nutrition, because it is the very thing that will either heal us or kill us. And we must know that when we collect the data in diverse diets like African heritage foods that are not invested in like the same rate of Mediterranean diets, we show the value of all Americans and not just some Americans.
I love your passion, and you said something really important about these diverse diets. I would posit that diverse agricultural ownership will also lead to more diversity and better nutrition in diets as well. And I'm sure you would agree with that, right? So I want to turn first to our friend Scott Carter, who's over at USDA. Very nice to see you online, Scott. One of my favorite people. So he has a question about what 2 to 3 priorities panelists feel should be addressed by the upcoming reauthorization of the Healthy, Hungry, Free Kids Act of 2010. So I actually would like to first go to Taylor on this, if you don't mind, if you're able to respond to this.
Oh gosh, yeah. So I could think of a ton of things. I think out of the bullet points that I made when I was thinking about this presentation, education was a big component of all, pretty much of those bullets. I think, nutrition education in schools, raising federal reimbursement rates for incentives and incentives for schools that use healthier ingredients in foods. I get very, my soapboxes, I get very tired of, the people that constantly, kind of go against change in the national school lunch and breakfast programs. And I kind of always use the simile, back in the 1990s, I never realized that my dream job that I actually am doing today would include answering 1 million emails a day, but that's where we are and that's what happens today. So, I think we need to get over that and really try to improve our school programs. I also think that, I think that federal, I think the other speakers are right. I think federal and state nutrition assistance programs are important. The produce prescription programs, things like that, which aren't directly related to the Healthy Hunger Free Kids Act, but do have implications on a ton of kids that, have type 2 diabetes, that are morbidly obese. I come from Kentucky where, you have these, obese children that walk in with gallons of, different sugar sweetened beverages. And it's just, I think we have to start thinking about healthcare at a much younger age to deal with the population. And I would say that my third thing would be kind of on those lines, but not directly related to the Healthy Hunger Free Kids Act, but somewhat indirectly related, is that, I really think we need to do better at maternal nutrition education programs, particularly within WIC, and expanding the benefits for mothers up to 2 years of their child's life. We know that the one thing that nutrition scientists all agree on, and we don't agree on anything, but we agree on that the first 1,000 days is critical for child development. And so I think education of the mothers, and I come from Kentucky where, here in DC, we're arguing, breastfeeding versus bottle feeding, but I've seen mothers that put soda in their infant's, bottle and give it to them. So I think education, again, big component, and a focus on the first 1,000 days.
So it's almost as if we're living in an ivory tower. So I want to actually turn to Dariush, not only to respond to that question as well, but I want to fold in another question I want to kind of summarize from Terry Hatami, because you were the one who mentioned about, as well as Taylor and others, about creating a new body. So in creating a new body, Terry's question is, it costs a lot of money to do something like that. How can we ensure its success and that it has some teeth?
Yeah, so yeah, great question. So just building on Taylor's comments on the Healthy Hunger-Free Kids Act, we have research that we've submitted for publication. I hope will be accepted soon, and you guys can all read, showing that schools are now on average the healthiest place in the country to get food, healthier on average than the grocery store, healthier on average than restaurants, than food trucks, than entertainment venues. And all of that happened after 2010. And disparities have been eliminated in schools in terms of nutrition quality by race or by income or by education. And so the Healthy Hunger-Free Kids Act, a single policy, turns schools into actually the healthiest place to get food. It's not perfect. There's ways to go. So I think in the reauthorization, keeping all of returning to all of the sound policies that were there is important. I would push more on the whole grains and reducing refined starches. It's right now it's just 50% whole grains. I think we should say, 50% of items have to have 50% whole grains. We should push that and make it more stronger. And then this is a minor thing for me, but we've banned plain whole milk, but we allow chocolate skim milk. At least let's put plain whole milk back so kids have a choice and they can drink plain whole milk if they want to. But I think the Healthy Hunger-Free Kids Act is excellent. It just needs to be strengthened modestly and enforced. And sorry, Danielle, please. In terms of the Office of the National Director was the second question. So the Office of the Director of National Intelligence gives us a really nice, clear precedent. And I absolutely agree. If a new food czar doesn't have structure and authority and budget, it's just a symbolic position. And so the Office of the Director of National Security has no new budget. It gets its budget directly from all of the agencies, a very small percentage from all of the agencies. There's a few permanent staff, but the majority of staff are detailed from all the relevant agencies. And then the Director of National Intelligence has the ear of the president, reports and provides information to Congress and all the agency heads. So that structure with a budget that comes from the organizations it represents, staff that are detailed from the organizations it represents, and a clear authority position near the president is really important. And so an Office of the National Director of Food and Nutrition would work the same with detailed staff from EPA, FDA, CDC, NIH, CMS, USDA, NASA, the Department of Defense, the VA, all the organizations that actually have existing food and nutrition efforts and policies with small amounts of budget that come from those organizations. And I think that kind of long-term structure and authority is what's needed for maximum success.
I agree, and I would add to that we need more public-private partnerships. We need a better ability to tap into the talent in industry and ways that we can do that. So I have one question for Julie, and I'm sorry because there's so many really great questions that are coming in from our audience. I'm trying to pick and choose as well as possible, but some of you I might write offline. And this is something we haven't broached yet, which is about biotech, and comes from one of our senior fellows, Divya, brilliant Divya Chander. Thank you very much. How can biotech, when we talk about nutrition density, if we want to increase nutrition density, what role does biotech play in that?
Yeah, that is a great question. I think there's been such an interesting, maybe Josh mentioned it right at the beginning around greenwashing or the concept around potentially consumer perception. So one thing that's come up to me, and I'll get back to that, across the board here, and Tamra really was bringing it home for me. I look at Tamra and I see these beautiful books behind her. We're talking about Michelle Obama, we're talking about Taylor on Dr. Oz. We're talking about stories, and we're talking about communicating. I think everybody on this panel are phenomenal communicators, and they have an ability to be able to engage people's heart, or to be able to understand, or to really feel what you're talking about. So the thing that's really come across for me across the board, it's sort of a low-hanging fruit. I'm not a policy expert, but I work in communications, is how do we get people's hearts and minds wrapped around what we're talking about before we're able to get to a policy level, or we're able to really change the systemic of the food system? How do we tell these stories in ways that people really feel connected to and really engaged? And that actually comes back to biotech in the sense that there's been a story that was a very, well-funded, compelling, sexy story about GMOs and what they were doing to you and where they were coming from. And I think that really ended up, sort of in a certain extent, backfiring, and there was, I won't go into the details of my opinion about it, but I think it lost the opportunity for communicating what the actual benefit is of biotech, to be able to really feed healthier food, feed larger populations. And so I think that from my perspective, there's a little bit of a new opportunity. I think that the openness to technology and data, and I think the key thing is really being able to really strongly communicate the story through good storytelling, for people to be able to get on board with it. So that's what I have to say about that.
I think that's really critical and key. And I realize now that we have less than 8 minutes, so I'm going to go to a quick lightning round for all of you. In a very succinctly, can you give me 2 to 3 tweets about what our take homes are and things that you want to impart upon our audience, upon our policymakers, and upon consumers? I'm going to start ready with Josh, then Julie, then Taylor, then Tamra, then Darius.
I think the key is really we need to align other stakeholders. Everyone talk about government and policy, which has tremendous influence historically, but what if we could get financial markets, multinational corporations pulling in the same direction? It builds a bit on Julie's last comment on encouraging the data, the science. If there was a way to tell if that GMO technology was improving human health, could then policy, corporate America, the corporate world, and financial markets align behind it? So I would just emphasize the point of elevating true data to a digestible, easy to use format to really help all stakeholders pull unanimously in the same direction.
Julie?
I'll keep mine brief as a communicator, but I think communicate with credibility and heart to make change in the food system.
I think that's, people can smell insincerity a mile away. Next, Taylor, what are your 2 to 3 tweets?
So I think, to reiterate my first point about, crappy data resulting in shitty policy, I think improving data is big. I think, to go back to Dr. Mazafarian's point on the nutrition czar with current administration, I would say if we're going to have a nutrition czar, that they should be a credentialed nutrition scientist that understands the research, because you can find just about anything you want to support your opinion in that. And then lastly, I'd say we tend to major in minors, kind of building off of our final point. I am so sick of hearing about industry funded research. Unless you're going to fund it, then leave it alone. All the data says that it's not biased. And just because it doesn't support your position or opinion, we have bigger fish to fry out here. We are majoring in minors with things like that and GMOs.
I agree. That whole diatribe on industry-funded research has become a little bit old. And without any further ado, I'm going to turn actually now to Tamra.
Well, here's a few tweets. 1, data equals dollars. We need more inclusive, human-centered data. If we love data-informed policy, that means we must put the full human and see the humanity in all of us at the center of the policies, and remove the propaganda and the politics from our plates.
Very well said. And then I would like to turn to Darius.
Yeah, well, I think first the scope of the problem is unbelievable. This is the top issue for health, the top issue for sustainability, the top issue for economy, one of the top issues for racial equity, one of the top issues for national security. So that's the first tweet, is how big this issue is. The second is that this is all fixable. This is all fixable in the next 10 years if we actually put our mind to it. We have technology, data, information to really make a big dent in this and make a huge difference. And the third is that this is win-win. This is a win for business. This is a win for equity. This is a win for the government and for government budgets. This isn't progressive or conservative. This isn't blue or red state. This is win-win. So we should be able to fix food and nutrition. We just have to have people understand all these interconnections, break down the silos, and have evidence-based good policies and systems changes that are based on sound data.
You all had really phenomenal comments. So we have a couple minutes left, and I would like to ask everyone, what would you like to see us talk about next? Because I feel like we were a little limited with such great content here and great speakers. Can I turn to Tamra and ask her quickly that question? What is our next step?
Well, March is Women's History Month and National Nutrition Month. So to keep the conversation going and around genderizing nutrition, because women and girls are at the base of the pyramid around nutrition, is a very important next step of conversation. Again, if we know that power lies at the heart of what makes our plates, then we must understand the messaging that we've had around women in liberation and what that has looked like over the years, liberating ourselves out of the kitchen, only to then realize that is where the power lies. And we must recognize that not only from a practitioner perspective, but also as a policymaker of how do we reframe and shape and include the next generation as part of the solution maker, from the economic perspective, as well as to the cultural keeper perspective that women have traditionally played in it, and see it in a liberating fashion, which, as someone who died of the thought of home economics as a class, and now being a mom of two and realizing how critically important it means to be able to feed and nourish my children, to grow up healthy and give them that legacy of rich nutrition wisdom captured in cookbooks and our cultural recipes, I would have never thought as a science wannabe military academy person. So this is where full circle has come for me on recognizing the value of next conversation. How do we begin thinking liberation for women in connection to nutrition in our kitchens?
I love that. I have a 14-year-old son, and I teach him how to cook exactly for that reason, because I know a lot of adults don't, and as a result have poor nutrition. There's a question here from the audience that I want to ask. Sarah Hendren asks, how can we improve the data collected? I'm going to ask Josh.
That's an excellent question. I think that was really going to be my question at the round of how we can build that infrastructure to improve the data collected, because we know once we have it, we're there. But I think from our perspective, understanding how can we best support the advancement of modern science? How can we align on the definition? I think that's the big piece. Taylor mentioned, is an egg healthy or not? How can we just take the data we have today and agree on that baseline and go forward? I think that's going to be the most effective first step, and just really understand the roadmap from there to effectively advance data, because it is the input that we need to instill any of this change.
I would argue that we just need the investment in technology. You know, I'll take, for instance, calcium, a nutrient we all know is good for bone health. You know, one study kind of looks at bone mineral density and fractures, finds something different than another study. But these days we have, you know, radio labels for calcium, where we can follow calcium in the bone. Those radio labels have 100,000 year half-life, so we know when we can watch how the calcium goes into and out of the bone and to what part of the body and when it's excreted. You know, I think we're moving towards this personalized nutrition approach. I think that's a good thing. I don't think we're there yet, but some of these omics technologies, some of these radio label technologies, we have we've come a long way in nutrition science. I just think we need the funding, because the researchers, we don't have the funding to implement the technologies because they're still too expensive.
Thank you very much, Taylor. And with that, I realize we are completely out of time right now. Thank you, everyone. And I really appreciate, on behalf of the Atlantic Council GeoTech Center, thank you for participating in this important event, and reminding you to be bold, be brave, and most of all, be benevolent. Thanks so much, guys.